Hello everyone, and welcome. I'm excited to have you here today for our presentation on the Diploma in Clinical Nutrition with a focus on evidence-based practice. Today, we'll explore key concepts in clinical nutrition, look at how evidence guides our practice, and discuss ways to apply this knowledge effectively. I'm glad you could join me, and I look forward to sharing valuable insights with you all. Let's get started. Let's take a closer look at what this course covers. First, we'll explore professional ethics and research, which are fundamental to maintaining integrity and trust in our work. Then, we'll dive into therapeutic dietary interventions, understanding how tailored nutrition plans can support patient health. We'll also examine clinical assessment and diagnostics, essential tools for accurately evaluating patient needs. Next, we'll cover the metabolic foundations and physiology, giving us a solid understanding of how the body processes nutrients. All of these topics come together to provide a comprehensive foundation in nutritional science and patient care. This course is designed to equip you with the knowledge and skills needed to make a meaningful impact in the field. Fats are actually essential for several vital functions in our body. They play a critical role in maintaining cell membranes, which are like the protective barriers around our cells. Without fats, these membranes wouldn't be as flexible or functional. Additionally, fats are important for hormone synthesis, meaning they help produce hormones that regulate many bodily processes. They also assist in vitamin absorption, especially for fat-soluble vitamins like D, E, and K. Moving on to proteins, these are the building blocks for many things in our body. They help build and repair tissues, including muscles, skin, and even enzymes that facilitate biochemical reactions. Proteins are also crucial for making hormones that control various functions, making them indispensable for overall health. And then we have carbohydrates, which serve as the primary fuel source for our brain and muscles. When we think about energy, carbs are what our bodies turn to first. They provide sustained energy necessary for daily activities and physical exertion. So, in the context of our overall discussion on macronutrients, understanding these key roles highlights how each nutrient supports different aspects of our health and performance. Fats, proteins, and carbohydrates all work together to keep us functioning optimally. Now, let's move on to understanding how carbohydrates play a vital role in our energy, function, and gastrointestinal health. Carbohydrates are our body's primary source of energy, fueling everything from basic cellular activities to more complex physical movements. When we consume carbs, they're broken down into glucose, which our cells use to produce energy. But it's not just about energy. Carbohydrates also support proper gastrointestinal function. They provide fiber, which is essential for healthy digestion, helping to regulate bowel movements and maintain gut health. It's important to highlight that not all carbohydrates are the same. The quality and source matter. Whole grains, fruits, and vegetables are rich in fiber and nutrients, whereas processed carbs may lack these benefits. So, integrating good carbohydrate sources into our diet is crucial for overall health and optimal bodily function. This connection between carbohydrates, energy production, and gut health underscores their central role in our well-being, and ties back to the broader theme of maintaining a balanced, nutritious diet for overall health. Proteins are essential for tissue repair and metabolic regulation. They play a crucial role in healing wounds and rebuilding damaged tissues. Additionally, proteins help regulate various metabolic processes that keep our bodies functioning smoothly. When we talk about proteins as building blocks, we're emphasizing their fundamental role in constructing the structures our bodies need. So, understanding proteins is key to grasping how our bodies grow, repair, and maintain overall health. This ties directly into the broader theme of how nutrients support our body's complex systems. Let's talk about cell membrane integrity and protection. The cell membrane acts as a barrier, safeguarding the cell's internal environment while allowing essential nutrients to enter and waste to exit. It's crucial for maintaining cell health and function. Now, when it comes to absorption of vitamins A, D, E, and K, these are fat-soluble vitamins. That means they require fats to be properly absorbed by our bodies. Without enough dietary fats, our ability to take in these vital nutrients declines, which can impact everything from vision to immune function. Speaking of fats, omega-3 and omega-6 fatty acids are essential fats. Our bodies can't produce them on their own, so we need to get them from our diet. They play a significant role in supporting brain health, reducing inflammation, and promoting overall well-being. Fats, especially these essential fatty acids, are not just about immediate energy. They have a long-term impact on our health, particularly in managing inflammation and supporting cellular functions. So, in summary, fats and essential acids are fundamental for maintaining cell integrity, ensuring proper nutrient absorption, and supporting our overall health. They're key players in the broader picture of how our bodies sustain and protect themselves over time. Now, let's take a look at some of the essential micronutrients that play crucial roles in our bodies. First, we have regulators, which include inorganic elements. These are vital for maintaining bone health and ensuring proper nerve function. Think of them as the body's natural stabilizers, keeping everything working smoothly. Next up are minerals, which are organic compounds that act as coenzymes and antioxidants. These minerals help accelerate biochemical reactions and protect our cells from damage. They're fundamental to many processes we often take for granted. Finally, we come to vitamins. These organic compounds are indispensable for a multitude of biochemical pathways and support our immune system. Without them, many bodily functions would falter. Overall, these micronutrients, regulators, minerals, and vitamins, are the tiny but mighty components that keep our bodies resilient and functioning at their best. They truly highlight the importance of proper nutrition as a foundation for health. Now, let's take a closer look at some of the key vitamins that play a crucial role in maintaining our health. Vitamins like D, the B-complex group, and C are particularly important because they support essential functions in our bodies. For instance, vitamin D is vital for calcium absorption, which helps keep our bones strong and healthy. The B-complex vitamins are essential for energy metabolism, meaning they help convert the food we eat into the energy we need to go about our day. And vitamin C is well known for its role in immune protection, helping our bodies defend against illnesses. Understanding how these vitamins work highlights the importance of a balanced diet rich in essential nutrients, which ties into our overall theme of maintaining optimal health through proper nutrition. Today, I want to highlight some of the most critical minerals that play a vital role in our daily lives and in the broader context of resource management. These are iron, zinc, calcium, and magnesium. Each of these minerals is essential for various biological and industrial processes. For example, iron is fundamental for blood health and is a key component in steel production. Zinc is crucial for immune function and wound healing, while calcium is well known for its importance in bone health. Magnesium, on the other hand, supports muscle and nerve function as well as energy production. Recognizing the importance of these minerals helps us understand the broader theme of resource dependency and the need for sustainable management. As we continue, keep in mind how these critical minerals are interconnected with economic stability and technological advancement. Now, let's follow the journey of nutrients through the GI tract. It all begins with enzymatic breakdown in the mouth, where enzymes start to digest carbohydrates. From there, the process continues in the small intestine, which is the main site for nutrient absorption. Here, enzymes break down proteins, fats, and carbohydrates into their basic forms, allowing the body to absorb them efficiently. But it doesn't stop there. In the colon, microbial fermentation plays a crucial role, especially for fiber and other non-digestible components. These microbes break down substances that our own enzymes can't, producing beneficial byproducts like short-chain fatty acids. Understanding this pathway highlights how our digestive system is a highly coordinated and complex process, ensuring we extract the nutrients we need from the foods we eat. It connects directly to the overall theme of digestion and absorption, emphasizing the importance of each step in maintaining our health. Glycolysis, the Krebs cycle, and the electron transport chain are essential metabolic pathways that work together to convert nutrients into the body's primary energy currency, which is ATP. These processes are at the core of cellular energy production, powering everything from muscle contractions to nerve impulses. When we talk about cellular energy production, ATP is the key molecule that stores and supplies energy for most biological functions. Understanding how these pathways connect helps us see the bigger picture of how our bodies generate energy efficiently from the food we eat. So, in this part of the presentation, we're focusing on how metabolic pathways work together to produce ATP and keep our cells functioning optimally. Now, let's take a closer look at how our body expends energy. The main components include the energy used for BMR, which is the basic energy our body needs to keep functioning at rest. Then, there's the energy used for physical activity, whether it's walking, exercising, or any movement. Lastly, we have the thermic effect of food, which is the energy required to digest, absorb, and process the nutrients we eat. On the other side, we have energy intake, which primarily comes from the calories we consume through carbohydrates, proteins, and fats. Each of these macronutrients contributes differently to our overall calorie intake and plays a unique role in our energy balance. Understanding this balance is crucial because when energy intake matches energy expenditure, we maintain a stable weight. But if there's an imbalance, more intake than expenditure, we tend to gain weight, and if expenditure exceeds intake, we lose weight. So this slide emphasizes the importance of balancing what we eat with how much energy our body uses. Keeping this balance is key to overall health and managing body weight effectively. All right, let's take a look at the current evidence-based guidelines. Starting with 2020, we saw some major updates specifically related to vitamin D and calcium. These updates reflect the latest research on how these nutrients impact our health and help shape more accurate recommendations. Moving back to 2010, that's when the Dietary Reference Intakes, or DRI framework, was introduced for chronic disease prevention and management. This was a significant shift because it emphasized not just preventing deficiencies, but also considering long-term health outcomes. Going even further back to 1997, that's when the first recommended dietary allowances, or RDAs, were established specifically for wartime health. These RDAs provided critical guidance during a period when nutrition was a national priority. And if we go all the way back to 1941, we have the initial nutrition guidelines, which laid the foundation for how we approach dietary recommendations today. Altogether, these milestones show how our understanding and guidelines have evolved over time, continuously improving to promote better health based on the best available evidence. Let's take a closer look at how organ systems interact with nutrition in human physiology. This slide highlights the idea that our body systems don't work in isolation. They are deeply interconnected, especially when it comes to processing and utilizing nutrients. For example, the digestive system breaks down food, but then the circulatory system distributes those nutrients throughout the body, supporting cellular functions everywhere. Understanding these interactions is essential because it shows us how balanced nutrition supports overall health and proper organ function. It also emphasizes the importance of a holistic approach. What we eat influences not just one part, but the entire system. So, as we move forward in this presentation, keep in mind how these systems are intertwined and how nutrition plays a vital role in maintaining human physiology and health. Let's take a closer look at the intricate chemistry behind nutrient utilization and regulation. This is where biochemical pathways come into play, and they are fundamental to understanding how organisms process nutrients. These pathways are essentially a series of chemical reactions that convert nutrients into usable energy or building blocks for growth and maintenance. What's fascinating is how these pathways are tightly regulated to ensure efficiency and balance within the body. For example, when nutrient levels are high, certain pathways are activated to store excess energy, while others are slowed down. Conversely, during times of scarcity, pathways shift to mobilize stored nutrients or produce energy from alternative sources. Connecting this to the overall theme, understanding these biochemical pathways helps us grasp how the body maintains homeostasis and responds dynamically to different nutritional states. It's a complex but beautifully coordinated system that underscores the importance of precise regulation in health and disease. Let's explore how insulin, glucagon, and digestive enzymes work together to keep our metabolic state stable and ensure proper nutrient processing. These components are crucial for maintaining homeostasis, which is our body's way of keeping internal conditions balanced. Insulin and glucagon are hormones that play opposing but complementary roles. Insulin helps lower blood sugar after eating, while glucagon raises it when levels are low. Digestive enzymes, on the other hand, break down the food we eat into smaller molecules that our body can absorb and use. Together, enzymes and hormones regulate how nutrients are processed and stored, ensuring our metabolism functions smoothly. This intricate system highlights the importance of enzymes and hormones in maintaining overall health and stability within our bodies. Now, let's talk about how nutrients can interact to influence absorption in our bodies. For example, vitamin C plays a key role in increasing iron uptake, which is crucial for preventing anemia. When we consume foods rich in vitamin C along with iron-rich foods, it can significantly enhance how much iron our body absorbs. This concept is part of the broader idea of bioavailability, which is all about how much of a nutrient our body can actually use after digestion. The idea of synergy is especially important here. It means that certain nutrients work together to boost each other's benefits. On the flip side, some nutrients can inhibit absorption, so understanding these interactions helps us make smarter dietary choices. In the context of overall health, recognizing these interactions can help us optimize nutrient intake, making sure we're getting the most out of the foods we eat. It's a reminder that what we eat isn't just about individual nutrients, but also about how they work together in our bodies. Let's take a closer look at some common methods used to evaluate dietary intake patterns. We often rely on tools like the 24-hour recall, food frequency questionnaires, and detailed diet histories. The 24-hour recall involves asking individuals to remember everything they ate and drank in the past day, which helps us get a snapshot of their recent intake. Food frequency questionnaires, or FFQs, are different. They ask about how often certain foods are consumed over a longer period, like weeks or months, giving us a broader view of eating habits. Then there are detailed diet histories, where we explore a person's typical eating patterns, portion sizes, and meal routines in depth. These methods are all part of dietary assessment, which is crucial for understanding how people's diets relate to health outcomes. When we evaluate intake patterns, we're looking for consistency, variety, and potential nutritional gaps. Remember, the choice of method depends on the research question, resources, and the level of detail needed. By combining these approaches, we can get a comprehensive picture of dietary habits, which is vital for making informed health recommendations. So, in the context of our overall presentation, understanding these assessment tools helps us better interpret dietary data and its impact on health. Let's take a closer look at some key anthropometric measures we use to assess body composition and health risk. First, we have the mid-upper arm circumference, or MUAC, which is a useful indicator of muscle stores. It helps us understand nutritional status, especially in populations where more complex measurements might not be feasible. Next, we have waist circumference, which is particularly important when assessing central adiposity, or the distribution of fat around the abdomen. This measure is a strong predictor of health risks like cardiovascular disease and diabetes. Finally, there's the body mass index, or BMI. BMI provides a general classification of weight relative to height and is widely used for screening and categorizing weight status across populations. All of these measurements, MUAC, waist circumference, and BMI, are essential components of anthropometric assessment. They give us a comprehensive picture of an individual's nutritional and health status, helping us make informed decisions and tailor interventions accordingly. Now, when we assess a patient's overall status, biochemical markers play a crucial role. Serum albumin, prealbumin, and hemoglobin are key indicators that give us a clear picture of nutritional and overall health. For example, serum albumin levels can reflect protein status and help us identify issues like malnutrition or inflammation. Prealbumin, with its shorter half-life, can show more recent changes in nutritional intake. Hemoglobin levels, of course, tell us about the oxygen-carrying capacity of the blood, which can be affected by nutritional deficiencies or chronic disease. In addition to these, inflammatory markers like C-reactive protein, or CRP, provide insights into ongoing inflammation or infection. Elevated CRP levels can indicate that there's an inflammatory process happening, which might impact nutritional status and recovery. Overall, these biochemical markers are valuable because they give us objective, measurable data that complements clinical observations. They help us gauge the patient's current status, track changes over time, and tailor our interventions accordingly. This is all part of a comprehensive approach to understanding and supporting patient health. Let's walk through the progression of nutritional deficiencies and how they can lead to severe health issues. Starting with stage 1, we see nutritional deficiencies, which are the initial lack of essential nutrients in the body. At this point, the deficiency might not cause obvious symptoms yet, but it's the foundation for what's to come. Moving on to stage 2, we encounter depletion of nutrient stores in the body. This means that the body's reserves are running low, and the risk of more serious problems increases. Then, in stage 3, biochemical changes and metabolic disruption occur. This is where the body's normal processes start to falter, and metabolic functions become impaired. Finally, in stage 4, the most severe stage, we see permanent damage or severe morbidity. Clinical signs and physical symptoms become evident, and if left unaddressed, the damage can be irreversible. Recognizing these stages is crucial for early intervention and preventing long-term health consequences, which ties directly into the overall importance of maintaining proper nutrition. Let's focus on the importance of emphasizing fruits, vegetables, and low-fat dairy in our diet. These foods are rich in essential nutrients that support cardiovascular health. At the same time, it's crucial to reduce sodium intake, as high sodium levels can raise blood pressure and negatively impact lipid profiles. By making these dietary choices, we're not only managing hypertension, but also promoting overall heart health. This approach, known as the dietary approaches to hypertension or DASH, highlights how simple adjustments in our eating habits can make a significant difference. Remember, small changes in our diet can have powerful effects on our cardiovascular well-being and help us maintain a healthier life. Now, let's talk about how modifying our intake of protein, phosphorus, potassium, and fluids can really support kidney and liver function. When these organs are compromised, managing what we consume becomes crucial. By adjusting protein intake, we can help reduce the workload on the kidneys and liver, preventing further damage. Similarly, controlling phosphorus and potassium levels is vital because imbalances can lead to serious complications. Limiting fluid intake is also important, especially if the kidneys aren't able to filter fluids effectively, helping to prevent fluid overload. Overall, this approach, sometimes called managing organ load, aims to lessen the stress on these vital organs. It's a key part of renal and hepatic care because it helps slow disease progression and improves patient comfort. Remember, these restrictions aren't just about limiting intake. They're about supporting the overall function and health of the organs, which ties into our broader goal of comprehensive organ support and patient management. Now, let's talk about managing conditions like IBS, IBD, and celiac disease through targeted elimination and nutrient-dense recovery plans. These approaches are all about customizing the diet to reduce symptoms while ensuring the body gets the nutrients it needs. One key intervention is the low FODMAP diet, which focuses on reducing fermentable carbohydrates that can trigger gastrointestinal symptoms. This diet has been shown to be effective in alleviating discomfort for many patients with these disorders. Overall, the goal is to identify specific food triggers and create a sustainable plan that promotes healing and long-term gut health. By doing so, we can help improve quality of life and support the body's natural recovery processes. Let's talk about how making lifestyle changes can really impact your diabetes management. One of the most important aspects is maintaining good glycemic control, which means keeping your blood sugar levels within a target range. This is key to preventing complications and feeling your best. Another essential point is carb counting. Understanding how different foods affect your blood sugar helps you make smarter choices and better manage your intake. It's not about avoiding carbs altogether, but about balancing them appropriately throughout your day. All of these strategies, lifestyle changes, monitoring your blood sugar, and carb counting, are interconnected. They form the foundation of effective diabetes management. When you integrate these habits into your daily routine, you're empowering yourself to take control and improve your overall health. Now, let's look at some nutritional strategies that can help prevent muscle wasting and cachexia. These conditions are common in critically ill patients and those undergoing cancer treatment, and they can significantly impact recovery and quality of life. When patients are severely ill, nutrition becomes a critical part of their care. Enteral and parenteral nutrition are two key approaches used to meet their nutritional needs when they can't eat normally. Enteral nutrition involves delivering nutrients directly into the gastrointestinal tract, usually through a feeding tube, while parenteral nutrition bypasses the gut entirely and delivers nutrients intravenously. In critical care settings, providing adequate nutrition is essential to support healing, immune function, and overall recovery. It helps to address the increased metabolic demands that occur during severe illness or trauma. When we consider oncology and critical care together, the challenge is even greater because cancer treatments often lead to increased energy expenditure and muscle loss. Supporting these patients with tailored nutritional strategies is vital to help them maintain strength and improve their response to therapy. Ultimately, the goal is to optimize nutrition to support recovery, minimize muscle wasting, and improve outcomes across these complex care scenarios. Let's take a closer look at some key nutrients that play a crucial role in immune recovery. Nutrients like arginine and omega-3 fatty acids are particularly important because they help support and enhance the immune system. When the body is recovering from illness or stress, providing these nutrients can make a significant difference. This concept falls under what we call immunonutrition, which focuses on using specific nutrients to strengthen immune function. By incorporating these nutrients into a patient's diet or nutritional plan, we can help promote faster and more effective recovery. So, overall, understanding and utilizing immunonutrition can be a powerful tool in supporting immune health and recovery processes. Let's take a moment to consider how nutritional needs change throughout life. As we age, our bodies undergo various physiological changes, especially in the geriatric years, which can affect how we absorb and utilize nutrients. Similarly, in pediatrics, we see rapid growth and development milestones that require specific nutritional support to ensure healthy development. Understanding maternal and fetal development is also crucial because nutrition during pregnancy impacts both the mother's health and the baby's growth. From conception through to old age, our nutritional needs evolve significantly, highlighting the importance of tailoring dietary choices to each stage of life. This slide emphasizes that nutrition isn't static. It's a dynamic process that responds to the biological and developmental demands at each stage. Recognizing these changes helps us promote better health outcomes across the lifespan, connecting to the overall goal of personalized, stage-specific nutritional guidance. Let's talk about nutritional support for milk production and maternal health. When it comes to lactation, breastfeeding plays a crucial role. Exclusive breastfeeding is highly recommended for the first 6 months, providing all the necessary nutrients for the baby. As the infant grows, complementary feeding becomes important to meet their evolving nutritional needs. During infancy, there's an increased demand for vital nutrients like folic acid, iron, and DHA. These nutrients are essential for brain development, immune function, and overall growth. Ensuring the mother has adequate nutrition supports both her health and the quality of her breast milk. Now, during pregnancy, proper maternal nutrition is even more critical. It directly impacts both the mother's health and the developing fetus. Good nutrition during this time helps prevent complications and supports optimal growth and development. Overall, supporting maternal nutrition isn't just about the mother. It's about laying a strong foundation for the child's health and development from the very beginning. Establishing healthy eating patterns is essential for lifelong wellness, and it all begins early. When we think about habits, we're talking about the routines and choices that set the foundation for good health over time. These habits influence not only physical health, but also brain development and growth. Supporting rapid brain development in those critical early years requires specific nutrients. Nutrients like omega-3 fatty acids, iron, and vitamins play a vital role in cognition, helping children develop strong thinking and learning skills. Calcium and protein are also crucial. They support the development of bones and tissues, ensuring that growth is steady and strong. These nutrients are the building blocks for healthy development, especially during the pediatric growth phase. Focusing on pediatric growth means paying attention to these key nutrients and habits, because they directly impact a child's ability to grow, learn, and thrive. By establishing these healthy eating patterns early on, we're not just supporting immediate health, but also laying the groundwork for a lifetime of wellness. Managing sarcopenia, osteoporosis, and chronic disease risk is a crucial aspect of healthy aging. As we age, our bodies naturally go through changes that can impact bone density, muscle mass, and overall health. That's why nutrition plays such a vital role in mitigating these risks. Proper nutrition helps preserve muscle strength and bone health, which are essential for maintaining independence and quality of life. When we talk about managing these conditions, we're really focusing on targeted dietary strategies that support bone density, muscle maintenance, and overall metabolic health. It's all interconnected. What we eat directly influences our ability to prevent or slow down conditions like osteoporosis and sarcopenia, and also helps reduce the risk of chronic diseases such as diabetes and heart disease. By making mindful nutrition choices, we can significantly improve health outcomes as we age, ensuring that we stay active, strong, and resilient. This aligns perfectly with our overall goal of promoting healthy aging through effective lifestyle and nutritional interventions. Let's talk about practical planning when it comes to maintaining a healthy diet. One of the key aspects is cultural adaptation. This means adjusting your meal choices and cooking methods to fit your cultural preferences and traditions, making it easier to stick with healthy eating habits long-term. Next, we have balanced portions. Understanding portion sizes is crucial because it helps prevent overeating while still satisfying your hunger and nutritional needs. It's about finding that sweet spot where your meals are satisfying but not excessive. Then, we move on to meal planning principles. Developing a simple, consistent approach to planning your meals can save you time and reduce stress. It also ensures you're incorporating a variety of nutrients throughout the week, supporting overall health and well-being. All these points tie back to the overall theme of creating sustainable, realistic eating habits that fit your lifestyle. When you adapt culturally, control portions, and plan effectively, you're setting yourself up for success in maintaining a balanced diet. Let's start by looking at meal and snack timing. It's really important to plan when we eat throughout the day to maintain energy levels and support metabolic health. Proper timing can also help with managing hunger and preventing overeating. Next, we have calorie and macro targets. Setting these goals helps us tailor our nutrition to meet specific health or performance objectives. Whether it's balancing carbs, proteins, and fats, or staying within a calorie range, these targets guide us toward making smarter food choices. Then there's smart goal setting. Remember, SMART stands for specific, measurable, achievable, relevant, and time-bound. Applying this framework ensures our nutrition goals are clear and realistic, increasing the likelihood of success. Moving on, personalized nutrition interventions are key. These are based on thorough clinical assessments and individual goals. Every person has unique needs, so customizing strategies ensures that the interventions are effective and sustainable. Finally, all of this ties into creating individualized plans. By considering timing, targets, SMART goals, and personal assessments, we develop tailored nutrition plans that fit each person's lifestyle and health objectives. This personalized approach is essential for achieving meaningful and lasting results. Let's talk about building self-efficacy for long-term adherence, which is really at the heart of sustaining healthy behaviors. Support plays a crucial role here, especially when it comes to modifying negative thought patterns about diet. Sometimes, we all have those inner dialogues that tell us we can't do it or that healthy eating is too hard. Addressing those thoughts is key to changing behavior. Next, we have cognitive strategies, like using motivational techniques to resolve ambivalence. Often, people feel torn between different choices or unsure about making a change. Helping them explore their motivations and resolve that inner conflict can really boost their commitment. Then there's interviewing. This involves tracking food intake and symptoms, which raises awareness about eating habits and how they relate to health. When clients see their patterns laid out clearly, it becomes easier for them to make informed decisions. Finally, monitoring behavioral strategies are about ongoing support, keeping track of progress, adjusting plans as needed, and reinforcing positive changes. All these components work together to empower individuals, build confidence, and foster sustainable habits over the long term. This approach aligns with our overall goal of helping clients not just make a change, but maintain it for life. Now, let's talk about the importance of engaging families to create a supportive environment. When families are involved, it can make a huge difference in a patient's overall well-being and recovery. Building that sense of collaboration is essential because it fosters trust and open communication. Next, we have demonstrating compassion during challenges and setbacks. Remember, setbacks are a natural part of any process, but showing genuine compassion helps patients feel understood and supported during tough times. It's about being there for them, not just clinically but emotionally as well. Empathy is another key element. Fully attending to patient concerns and validating their experiences is crucial. When we listen with empathy, we acknowledge their feelings and perspectives, which can significantly enhance their comfort and trust in us. Active listening is the cornerstone of this approach. It involves more than just hearing words. It's about truly paying attention, understanding their concerns, and responding thoughtfully. This technique helps us connect on a deeper level and ensures patients feel heard and valued. Finally, counseling techniques tie all these elements together. Using effective counseling strategies, grounded in empathy and active listening, allows us to support patients more effectively. It's about creating a safe space where they feel comfortable sharing and working through their challenges. In summary, by engaging families, demonstrating compassion, practicing empathy, and employing active listening and counseling techniques, we can foster a supportive environment that truly makes a difference in patient care. Let's take a closer look at the role of functional foods in preventing chronic diseases. First, prevention is key, and it's important to evaluate scientific claims carefully, distinguishing solid evidence from marketing hype. Not all products marketed as health-boosting have proven benefits, so critical assessment is essential. When we talk about evidence, we're referring to foods that offer health benefits beyond basic nutrition. These are foods that can actively contribute to disease prevention or management. You might have heard terms like nutraceuticals and functional foods. Nutraceuticals are products derived from food sources with medicinal or health-promoting properties, often in supplement form. Functional foods, on the other hand, are everyday foods that naturally provide additional health benefits, like oats for heart health or yogurt with probiotics for digestion. Recognizing these distinctions helps us understand how certain foods can play a proactive role in maintaining health and preventing chronic conditions, tying back to our overall theme of nutrition's power in health promotion. When considering supplementation, it's important to use a strategic approach, especially when addressing documented deficiencies. This means targeting specific nutrient gaps to improve overall health without overdoing it. At the same time, we need to be cautious about the toxicity risks, particularly with fat-soluble vitamins like D, E, and K. These vitamins can accumulate in the body, so megadoses can be harmful. In clinical practice, this balance is crucial. We want to correct deficiencies safely and effectively, which is why monitoring and personalized dosing are key. When it comes to safety, always evaluate the patient's individual needs, existing levels, and potential risks before recommending supplements. Remember, supplements should complement a balanced diet, not replace it. Ensuring proper vitamin and mineral intake through careful supplementation can support overall health, but we must avoid excesses that could lead to toxicity. This approach aligns with the overall theme of promoting safe, evidence-based nutritional support for optimal well-being. Now, let's take a closer look at evaluating the efficacy and potential medication interactions when it comes to herbal supplements and probiotics. Herbal supplements can be beneficial, but it's important to assess whether they actually work and how they might interact with other medications a patient is taking. When we talk about live microbes for gut health, we're referring to probiotics that can help restore or maintain a healthy balance of bacteria in the digestive system. These probiotics are particularly useful in cases like antibiotic-associated diarrhea, where antibiotics might disrupt the gut flora. It's crucial to understand that not all probiotics are the same, and their effectiveness can vary depending on the strains used and the individual patient. That's why evaluating both the benefits and the potential risks, including interactions with medications, is key to providing safe and effective recommendations. Connecting this to the overall theme, it's about personalized care, making sure that any supplement or probiotic we suggest aligns with the patient's health status and medication profile. When evaluating nutritional research, it's crucial to first recognize potential industry bias and reporting errors that might influence the findings. These biases can distort the evidence we rely on, so being aware of them helps us maintain objectivity. Systematic reviews and meta-analyses are valuable tools because they combine data from multiple studies, giving us a broader and more reliable picture. Randomized controlled trials, or RCTs, are considered the gold standard for establishing cause and effect relationships in research. However, even the best studies need careful critical appraisal to determine their validity and relevance to practice. This process involves scrutinizing the study design, methodology, and reported outcomes. Ultimately, evaluating evidence thoroughly is essential for making informed, evidence-based nutritional recommendations. As we've seen throughout this presentation, developing a keen eye for bias and errors ensures that our practice is grounded in the most trustworthy science available. Let's take a look at some of the current trends shaping the future of personalized nutrition. First, plant-forward diets are gaining prominence, not only because they benefit our health, but also because they are better for the planet. Moving toward more plant-based foods can help reduce our environmental footprint while supporting our own well-being. Next, when we talk about sustainability, it's about more than just the environment. It's also about ensuring that our food systems are resilient and capable of meeting future demands, which ties into the importance of innovative solutions like AI and apps. These technologies are enabling real-time nutritional monitoring, giving us immediate insights into our dietary intake. Imagine apps that help you track nutrients on the go, making healthy decisions more accessible and personalized. And speaking of personalization, the field of nutrigenomics is really exciting. By analyzing genetic profiles, we can tailor nutrition plans specifically suited to each individual's unique genetic makeup. This means more effective, targeted dietary strategies that optimize health outcomes. Altogether, these trends, plant-forward diets, technological innovations, and personalized approaches, are transforming how we think about nutrition, making it more sustainable, precise, and aligned with our overall health goals. Let's take a closer look at study designs and bias control in nutrition research methodology. When we're designing studies, it's crucial to choose the right approach to ensure our findings are valid and reliable. Different study designs, such as randomized controlled trials, cohort studies, or case control studies, each have their strengths and limitations, so selecting the appropriate one depends on the research question we're trying to answer. Controlling bias is also a key part of this process. Bias can creep in through various sources, like how participants are selected, how data is collected, or even how results are interpreted. To minimize bias, researchers often implement strategies such as randomization, blinding, and careful selection of control groups. By understanding and applying these methodologies carefully, we strengthen the credibility of our research and ensure that our conclusions genuinely reflect the effects of the nutritional factors we're studying. This, in turn, supports evidence-based recommendations that can improve public health outcomes. Ultimately, rigorous study design and bias control are fundamental to advancing our understanding in nutrition science. Now, let's talk about applying peer-reviewed evidence to clinical practice. This is a crucial step because it ensures that the care we provide is based on the most reliable and validated information available. When we interpret the literature, we're not just reading it passively. We're actively analyzing and understanding the findings so we can determine how they fit into our specific clinical context. Key points to remember are that peer-reviewed studies have undergone rigorous evaluation, which helps us trust their validity. But we also need to interpret these findings critically, considering factors like study design, sample size, and relevance to our patient population. By doing this, we bridge the gap between research and practice, making informed decisions that truly benefit our patients. This process reinforces the overall theme of evidence-based practice, using the best available evidence to guide our clinical choices, ultimately improving outcomes and ensuring high-quality care. Let's now turn our attention to some critical ethical considerations: confidentiality, consent, and conflicts of interest. These are fundamental to maintaining integrity and trust in any professional setting. First, confidentiality means respecting the privacy of information shared with us. It's about safeguarding sensitive data and only sharing it when appropriate and authorized. Next, consent is all about ensuring individuals are fully informed and agree voluntarily before participating in any activity or providing personal information. It's a key part of respecting autonomy. Lastly, conflicts of interest can arise when personal interests might influence professional judgment. Recognizing and managing these conflicts is essential to uphold objectivity and fairness. These concepts are interconnected and vital for fostering ethical practices that align with the overall theme of integrity and responsible conduct in our work. When we look at career pathways in healthcare, there are quite a few options to consider. Hospitals are a major setting where many professionals work, providing direct patient care and specialized services. Private practice is another avenue, offering the chance to run your own clinic or practice and focus on particular areas of interest. Research is also a vital part of the healthcare landscape, allowing us to push forward medical knowledge and develop new treatments. Finally, public health plays a critical role in preventing disease, promoting health education, and shaping health policies that impact entire communities. All of these pathways are interconnected and contribute to the overall goal of improving health outcomes. Whether you're interested in direct patient care, innovation, or community health, there's a pathway that fits your passion and skills. This diversity in career options is what makes the healthcare field so dynamic and impactful. Now, let's talk about the importance of engaging with professional nutrition societies. These organizations play a vital role in our field by offering ongoing competency and continuing education opportunities, which help us stay current with the latest research and best practices. It's not just about acquiring knowledge, it's about ensuring we maintain a high level of professionalism throughout our careers. Additionally, development within these societies encourages us to grow as professionals, embracing new techniques and insights that can improve our practice. Of course, all of this must be grounded in adhering to regulatory frameworks and licensing requirements, which are crucial for maintaining credibility and ensuring we're practicing ethically and legally. Compliance with professional standards is the backbone of our work, as it helps us uphold integrity and trust with our clients and the public. So, engaging actively with these organizations not only supports our ongoing development, but also reinforces our commitment to excellence in the field. Ultimately, it's about ensuring we provide the best possible care while maintaining the highest professional standards.